Sir, we are live now.
Okay. Good evening to everybody. This is Dr. Hamza, and today we are going to discuss a very important aspect of any examination journey, that is OET. OET is basically that is occupational English testing service, which enables the healthcare professionals specifically to embark on their examination journey into major healthcare systems of the world. So, in simple words, you can say that OET is your building block, your very first step for any of the examinations you're going to conduct at the earliest stage or the later stage of that you're going to need it. So um, that's why I found OET to be the very first topic that should be discussed at every forum where students and candidates are guided about their examinations. Next, please. Next slide. So, what is OET basically? As I have already told you, it's an English language proficiency test for healthcare professionals, particularly designed for healthcare professionals to excel and to show their command on the English language, and and to satisfy the board that they are able to communicate well, understand well, in the formal language of English. Um, so specifically designed for healthcare professionals. Before OET, people used to give IELTS test for examinations that are related to healthcare professionals too. But in IELTS, what problem was, people were not able to score the required bands because of the difficulty level of the IELTS, specifically in the writing subtask. So what it was proposed that a form should be made for the healthcare professionals where they can engage in their own language, in their own terminologies, and they should be tested in the very particular subjects, in their very particular manner regarding and related to their field. And so OET was designed for that. It's comparatively easy to IELTS, and you can even score good marks in the OET with less timely preparations as compared to the IELTS. So it was it has an upper hand to healthcare professionals as compared to the IELTS. So the OET examination is conducted in two ways. That is on-site examination. That is basically a physical examination where you have to attend a center in your required home country and write it on a piece of paper. So that is paper-based OET conducted at various centers, which are allocated through OET officials, and there you can go and take your exam. That is paper-based OET. Number second, they offer you online OET, that is computer based, and for that OET you can also visit the required center to take the online exam, and as well as you can take the exam at your home, that is at home center. For that you need to pass the internet requirement test, where you can satisfy the officials of the OET that your internet connection is stable, there are no distractions, and then if they are, you can take the OET exam at your home too, but that will be online through the computer. So there are two ways you can take your OET exam. Now, which one to choose and why? Um, as far as the data is concerned, so the paper-based OET passing rate is quite more than that of the computer-based OET. And why is that? Because from our really early schooling until now, we are more related to uh, writing on a paper-based system rather than computer typing. And because of the short duration of time and multiple tasks to perform during your OET exam, which we'll discuss in further slides, paper-based OET will save you time because of your familiarity with the paper-based exams, and as well as make you more efficient to perform well as compared to the computer-based. So that's why people uh, used to, and people still choose paper-based OET over the computer-based, unless until there is some major reasons to avoid paper-based OET. Next slide. So the second question which comes in everybody's mind after they hear about the OET is exam costs and centers. So regarding the exam costs, so it's basically an Australian made platform, so you have to pay in the Australian dollars. That is 587 Australian dollars, which approximately which you can convert in your own country currency. But in Pakistan, it costs you around 110 to 120, 100,000. That is 1,20,000, in which you can take your OET exam. So in US dollar, in Australian dollars, it's 587, and you can convert it into your own currency, and you will get definitive amount of the fees of the cost which will be required to take your OET exam. Number second point is about the centers. So various centers are located in almost every country of the world where the healthcare system is defined, and they have doctors, they have proper healthcare system, and people from their country are moving abroad. So their OET have made official centers almost in all major cities of the world, of the particular countries where you can go and take your exam. So exam centers has never been an issue with the OET. So you can. So that was about the exam costs and centers. Next slide. So now the main components of the OET. OET exam basically consists of four subtests. That is reading, listening, writing, and speaking. So it's four
Sir, we
subtest
have
exam.
question.
So it's a four subtest containing exam starting with the reading, listening, writing, and speaking. And it's a grading system here, in which your marks will be according to the grades. You will be graded according to your performance in the required subtest, and then you will be allotted a grade. So to make you pass in the exam, you will have to score B grade in all of the subtests. If you are able to score B grade in three of the subtests and not able to score B grade in any of the one of the subtests, you will be declared unsuccessful in the OET. For OET, the minimum requirement is scoring at least B grade in all of the subtests. You will have to score B grade in all of the subtests, then you will be declared a successful candidate of your OET. So the system of marking is basically it's a grading system. You will be graded according to your performance, and then that grade in each of the subtest should be at least B to declare you successful. Next slide. Please ask your questions, and then I'll answer them at the end of the session. So let me first complete the presentation, and then all of your questions will be answered at the end of the session more thoroughly, and we'll discuss them. So as I've already told you that you have to score B grade in all of the four subtests to be declared successful candidate of your OET exam. B grade is the minimum requirement. Above B grade you can score as well, but B grade is the minimum requirement. And all the major healthcare system in the world, like NHS for the UK, the Australian Medical Council, the USMLE, and all other major systems of the world where healthcare is very well defined and people used to go there for training, which are commonly known among us, according USMLE, AMC, and the NHS system. So there, the OET score are accepted, and for them, the major and the least requirement is at least B grade in all of the subject. But in USMLE, if even you have scored C plus or C in the writing session, and B in all of the above, still you will be declared successful, and you can you are eligible to apply for the residency in the USMLE. But for PLAB and AMC exam, B grade is the must requirement. But in USMLE, some of the states do have a leniency in the writing, that they give you a super edge if you are even getting C plus in the writing. So still they offer you a pass grade, and make you and accept you as a successful candidate of your OET. So, but to be on the very safe side, B grade, you should all aim at scoring at least B grade in the OET exam. Next slide. Next, please. So now a brief description of each of the subtests, that what each subtest consists of, and what they ask about and how it is performed. So the first and the major subtest, which people find it very difficult to excel in, and people used to struggle it a lot in it, as a writing subtest. So the writing subtest basically consists of a letter writing task. You are given a proper case note, of a patient of any age group, of any problem. You will be given proper details of the patient, his biodata, his presenting complaint, his past history, past medical, past surgical, the doctor consult, and one visit, then the follow-up visit, and then the last visit. So you'll be given proper case notes, and then you will be asked that based on these case notes, write one of the letters to the particular surgeon, to the particular doctor, to the particular nursing home and physiotherapist, and any of the major specialty, to let them know about the condition of the patient. So it's a case-based nose writing task. That is the writing session of the OET. Now, you should prepare yourself to write a letter to any of the specialty, because it is not defined that you will be getting almost and you will be always getting an adult man, adult woman presenting to your clinic, and you'll have to write to a clinician about her. You can write to any of the healthcare professional about the condition of the patient, and patient can even be a boy, an unmarried man, an unmarried woman, a child, and an old man, a widow, a worker, any age group, and any social worker can present to your clinic, can be in your case notes, and you'll have to write to any of the healthcare professionals. So you should not confine yourself to just clinicians and a particular age group. Now, as I have told you about different specialities, different conditions, now let's come to the main topic about the major types of the letter in which you are tested. So the most common coming letter in the OET exam for the past time was a refer letter. And after that, the second most common was a discharge, and the least common, which rarely come in the exam, is the transfer letter. But there is possibility that any of the letter can come in your exam, and you should prepare three of the patterns equally to be able to secure your spot of the B grade in the writing session. In the referral letter, so first we'll discuss about the referral letter. In the referral letter, what happens that you are asked to write to a particular doctor about the condition of the patient to whom you are referring her. You are referring the particular patient to a doctor, and you are asked that how will you refer this patient, and what information you will include in your letter writing and what not. So that's the participation thing to do, that what information will you include in your letter writing, and what information you will not include in your letter writing about your patient, to whom you are referring. That's the major topic. For example, you are referring the patient to a GP, a general physician, but that GP is the family physician of the particular patient too. So it means that that particular doctor is already aware of the past medical and biodata of the patient, and the past medical conditions, past surgical condition, and present condition of the patient too. So you don't need to write that information repeatedly in your letter, which already the doctor know. For example, a GP of that particular patient, you're just referring her again back to her GP. So you don't need to write information which already the GP knows. But If you are referring the patient of yours to a new doctor to whom he or she had never been, you'll have to write each and every relevant information regarding his present condition, her past condition, her biodata, any of the significant social history. You have to write each and everything relevant to the particular problem of the patient. Relevancy is the most important thing in the letter writing. If you are writing irrelevant information and skipping the relevant information, that will cost you your marks, and you will lose your marks, and you'll not able to score your B grade. So that's the major thing about referral letter. Now in discharge letter, so a basic overview is that the pattern of the letter do change in each of the subtests, like referral letter, discharge letter, and transfer letter. Pattern of the letter do changes, but the information remains the same. Information remains the same in a sense that the relevant information should be included in every type of pattern in which you come across in your exam. So writing the relevant information, avoiding the irrelevant information, and deciding which information to include and which to not, and seeing that to whom you are referring the patient. So that was all about the writing subtest, uh, that how you are tested, and there are different patterns of the referral, discharge, and transfer. And so, as I've told you about the score, that B grade, achieving B grade is must in the writing and reading and each of the every subtest. So, furthermore, digging into the each pattern of the letter, and each and the grammatical mistakes, the grammatical terminologies of the each pattern will be discussed in the very another session, which we will organize about the writing and speaking, and we will organize courses in which there will be one-to-one sessions and group sessions about speaking and letter checking of the OET candidate. So we are working on that on the courses to introduce. So the deep digging will be in that, including the grammatical mistakes, the appear, how to prepare your letter, how to start, how to end, what to include, what to not. So that will include later on. Next slide. Next, please. So the second subtest is a reading subtest. So reading subtests have three parts: part A, part B, and part C. Part A is you are given first a booklet, which consists of the part A subtest, in which you are tested. And achieving maximum score in part A is the main aim of your reading subtest, and it should be your main aim, because the part A is comparatively easier part to part B and C of the reading, and you will have to and you should try to achieve a maximum score in the part A. If you are able to achieve a maximum score in the part A, your chances of passing your reading subtest will goes up, and you will not be much confused and much tensed about your part B and part C, because part B and part C are quite tricky, and each of the options seems so similar that if you have not a proper grip on your reading, you will not be able to pick the right answer. So for to avoid that confusion, you'll have to score maximum in the part A. So you'll given a booklet that consists of the part A and how you're tested. And first 6 questions, they are given you a lines are taken out from the different paragraphs, from 1 to 4 paragraphs, and you will be asked that which paragraph does this line contain of, or this line is taken from the which paragraph. You'll have to write the number of the paragraph, whether it's A, B, C, or D. So that's how you do it. Number second, you will be given a short term, and the next blank will be missing. You'll have to put the right answer in the following blank by looking at the text. So it's a skimming thing in the reading. You'll have to be quick in skimming the right answer from the text. So the one error, one mistake to avoid in the reading part A, that you'll have to write the correct spelling. People used to make mistake that if you're write a friend in an answer, but you have write the wrong spelling of the friend, you'll answer will be marked wrong. So marking the right answer is very important, and writing the correct spelling of the particular blank is very important. And if the particular blank is in capital letters in the paragraph, you'll have to write in the capital letters. And if it's small letters, you have to write in the small letters. People are losing marks on that. And they, after exam, they used to say that we have performed very well, but in exam, they have scored C grade in the reading because of these very immature error, which they don't consider an error if you're not writing, I think, in the capital, which is already written in the capital letters in the paragraph. So avoiding these mistakes will give you a more better chances of passing. So reading part is comparatively easy. You'll have to be quick at skimming, picking up the correct answer. So let's talk about the listening. So for listening, the most important thing that you should be familiar with the British dialect, with the English dialect of the OET. And so in listening, there are two major subtests in which you will be given blanks, and you will have to write the correct answer listening to the audios. Then audios are quite clear. There is no there they in the centers they will give you particular headphones which you'll wear, and you will be able to hear the voice very correctly, very clearly. And but even if you are hearing it clearly, the dialect will be so new for you that if you have not familiarized yourself with the dialect, you won't be able to pick the words. And because they're speaking a bit fast, so you'll have to practice more at the dialect, listening more to the listening audios which are available in various OET documentations. You'll have to listen it more and more and improve your listening power by practicing more and more to pick up the words which can mumble up during their listening subtest. And this very commonly happens with the people that they are good at listening, but what happens that the blank is always jungle up between their conversation, and if you're not listening and concentrating and you have distracted even for 1 second, so you will lose the track. You will lose the track and you will not be able to stick on the one of the blanks. So all of the blanks can go wrong if you are distracted for even a if you are distracted even for a second. So attention and practicing on the speaking to hear the dialect properly, to pick up the words, to not confuse when the words are jumbled out between their conversation. So that will be the key to your success in the listening subtest. Next. So the most easiest part, according to me, of the OET is the speaking. What happens that there are two sessions or two cards. You'll have to be the candidate, and the examiner sitting in front of you will be the role player. So you'll be given your card, and you will be given 2 to 3 minutes to read your card and make up your points. And then the examiner will turn on the tape and record your voice to record the overall conversation. So there will be 5, 6 questions. At first, you will be given a scenario that this patient is presented to your clinic and particular problem, and now ask the questions. And in the same way, the role player account will consist of the question that the doctor will ask you this question, answer in that sense, and he is given, he or she is given his or her role player card, which consists of the same questions but in a very different manner according to you. So what happens, and what is the difficulty people feel in this speaking session, is that when they start the conversation, they are not able to start the conversation very properly with the patient. Number first thing, and the most important thing, is to introduce yourself to the patient. Welcome the patient, confirm the name and age of the patient. If you are seeing the patient for the first time, you'll have to confirm the name and age. You'll have to introduce yourself. But if you're seeing the patient on a follow up, you don't need to introduce yourself. You don't need to confirm the name and age. And you have to start the conversation in a very frank and friendly manner. That welcome back, good to see you back. So this should be your approach if you're seeing the patient for a follow-up visit. But you've seen the patient for the first visit. Hi, my name is Dr. XYZ. I'm one of the doctors working here. How may I help you today? What brings you to the hospital today? Can you confirm your name and age, please? After that, you will be going to perform the task. And if you are missing the task and not sticking to your task which you're given in the candidate card, you will be losing marks because they're testing you in that. The four main things which you should always remember in the speaking, that you should have the empathy. You should have a sense of sympathy too to the patient. You should be able to communicate with the patient very properly. and you should be able to make the patient understand about his or her problem, the diagnosis, the treatment, what you're going to offer, will it cure her or not. So all of these things are counted in your speaking subtest. So you should be a very communicable and a safe doctor performing the speaking subtest. So these are the area where you are testing. Most people confuse the speaking subtest with the fluency like the English one. That is not the case. Even if they know that we're Asians, we are not English born, so the dialect has always been a problem for us. So the dialect is not the main testing criteria for the speaking, but the fluency, the empathy, the sympathy, the connection, and to make your patient feel comfortable while he or she is talking to you is the main testing criteria for the speaking. So you should focus more on these things rather than improving your dialect, which carries no marks in the speaking. Next. So, after giving you a brief discussion and description of the OET, what it is about, how it is conducted, how you are tested, if you are a fresh candidate and ready to join your OET journey, and you're planning to take your exam in the near future or the upcoming time, so what we are planning, that we are going to introduce courses and sessions in two of the subtests which are difficult for the students. Number first is the writing subtest, and number second is the speaking subtest. In the writer sometimes which we'll offer you a proper notes, and we'll have daily or one day after sessions in each of the letter writing type, how to start that particular writer letter, how to end it, what to include, what to not, and we'll give you case notes, we'll give you a proper grammatical sentences, how to improve your grammar relevant to your OET. And so we are planning to introduce that courses in the writing subtest to help students ace their exam in the very first one, because with each passing day, the passing ratio of the OET is coming down. And without proper guidance, yeah, people are struggling for many attempts. So it's a waste of money if you are not having, if you're not getting a proper guidance, and you're even wasting your time too, because each year if you're giving attempts for 3 or 4 times, so it's costing you around 5 to 6 lakhs. So it's better to ace in the very first attempt with a proper guidance, and guidance is very must, and it is especially required in the writing, where someone should be there to check your letters, improve them, tell you your mistakes, send you notes again, uh, tell you to read these notes, these type of grammar, um, how to make your sentences more strong, what to include, what to not, where to put comma, where to not. So that's very important. And we are planning to introduce that courses, which should include the letter checking sessions and discussion about your letter, which you will be given task and you'll have to write them. Number second will be speaking. In speaking sessions, we'll conduct a group sessions where me as an examiner and people who are joining that session will be the candidates, and all other will be able to hear you and assess themselves and you, and then we'll take the feedback. So in this way you will improve yourself, and if somebody wants to one session, we'll contact them too. So that's two areas are majorly covered through mentorship. And about the reading and listening, as all I have told you, it's all about your skimming power and your practice that will make you more good in the reading and uh, um, listening subject. But still we'll give pro tips and to excel and to maximize your score in the reading and listening. But we are currently focusing more on the writing and speaking subtest to help students to ace these two areas with our daily or weekly sessions. We look upon the candidates, how many candidates are interested, and then according to their interest, we'll arrange the sessions of the writing as well as the speaking. So these two areas will be mentored by us, and inshallah, by the grace of Allah, you will be able to clear your exam in the very first go. So that should not be the problem. And mentorship is very necessary from wherever you are taking. But do take a proper checkup of your letters, because they are checked by the proper OET officials, and they will pick up your mistakes. And with each mistake, you lose 10 marks. And losing marks with each mistake will cost you a very low grade, and that and scoring a low grade in one and scoring a very high grade in all other will give you no benefit. It's a fail. Scoring a mediocre score in all of them with a proper preparation and focus to all of the four subtests will make you a successful candidate in the OET, because the passing ratio is decreasing as the day passes by. So a proper preparation and mentorship is very necessary if you want to ace your exam in the very first go. That's what I have learned, and that's how I prepared for my OET. When I prepared for my OET exam, I took the mentorship of seniors, of a proper guide who scored very well. And that particular person guided me very well. And I was able to score 420, 430, 400, and 410 in my subtest. My highest, the highest subtest in which I scored the most was speaking. In speaking, I scored 450. So it was all because of the practice and proper mentorship. Because practice without a proper direction and walking without a guidance is walking in a blind trail. So don't walk in a blind trail. Have a proper guidance and then practice upon yourself and improve and improvise. So that's how you're going to ace every exam. But for OET, these particular two subtests in which I have already spoke about, that includes the writing and speaking. That needs proper mentorship to improve your speaking skills, writing skills. And the other two subtests are your own practice things to do. Improve your skimming power, improve your listening power, listen to the podcasts, to the various listening audios available on the YouTube of the OET. So that's how you improve. And about the materials of the OET, um, we're going to make a proper list, a proper PDF, a proper booklet in which all the materials will be included along with their links for each of the subtests through which you can practice your OET preparation. So we're working on that. We'll make it in a very proper booklet, so you don't have to move, wander here and there in the search of the materials. Material is available everywhere, but it's scattered. We're going to make it in a very compact thing, compact file, and share it with you so that you can get maximum benefit of it along with the mentorship of ours. So in this way, inshallah, things will go very smooth for you. So now I'll take some questions if there are any, and then we are done here. So, okay. Grade B in reading, listening, and speaking. C plus in writing in the professional. I've heard this writing score accepted for Ireland. No, um, this is not true. For Ireland, for UK, you'll have to score B grade in all of the subtests. The C plus criteria is in US only, and that is even only for some of the states of the America, not all of them. So I have already told you, to be on the very safe side, try to score B grade in all of the subtests. And this way you will be eligible to any of the country in which OET scoring is accepted. On listening task OET, in UK, the center are providing headphones. Yes, they do. Even in Pakistan, almost 90% of the centers are providing headphones for the listening part, because it is somehow easy to pick up the words while you are wearing headphones rather than hearing up on them on the big speakers. So yeah, they do provide them. I sat for my OET on paper test on 6/12/20, and still haven't received my results. Basically, the OET result take almost 16 days. That is fortnight, 15, 16, 17 days. And so you should, in even if you're not getting your result because your time has already passed by, you should send a proper email to the OET about your candidate number, your test center, and the date on which you sat for your exam. So they will definitely guide you further that why your result is still on hold. Resources can be taken online. Are they authentic? There are a lot of groups where you can find the material. There are a lot of groups where you can find the material. There are a lot of people who are ready to give you their subscription, and you can prepare for them. But choose your mentor very wisely, because it is a costly exam, costing you $570 Australian dollars. So choose a proper mentor who can guide you very properly, especially for the writing and speaking subtest. Writing 320, everything above 350. If you are quite sure about your writing, that you are quite well in the writing, you have performed well during your preparation and mocks, so definitely you should go for the rechecking. Remember, rechecking is only effective in the writing, and and in that case, when you are quite sure about your writing task. Except that rechecking is just a waste of money and time. So if you are sure about that you performed well and you have not achieved the desired score, and you are not, and it's unexpected, so then you should definitely go for it. And if you are okay with your results, so better to reset. Can be given any month, shall we be prepared first, fully then work. um, you should book the exam first. You should book the exam at least 1 month before, and then prepare in 1 month. 1 month is quite sufficient time to prepare for the OET. So booking exam first will be more convenient. Doctor, do you recommend any valid and authentic organization for OET preparation? I do not recommend any. OET official do have their own subscription, but it's very costly. So, as I have already told you, that we are planning to introduce courses for the writing and speaking subtest, and you can have our demo classes later on and then decide whether it suits you and you're able to get what we are saying, so then you can proceed further. If you're getting 27, 28 in the reading Jashan benchmark, so it is a quite good score, because the benchmark and Jashan files are quite difficult. But still try to score more and find more materials on the YouTube, where online mocks are conducted. They are free, and you can recheck and check yourselves with your reading subtest there too. But scoring between 27 28 is not bad. But if you aim at 32 33, so that will keep you on the very safe side and will give you inner satisfaction that you are above the passing range. May I reset or remark my scores? Amin Hari have asked that may I reset or remark. So if you have scoring less in speaking, so there is no need of to recheck your result by paying them more money. It's better to reset, because score is not going to improve. So what is meant by reset or remark? Reset is basically taking the exam again, and remark is if you are scoring not the desired grade in any of the subtests, so you apply for the rechecking. That I am not satisfied with my result, please recheck. But in most of the cases, score doesn't improve, and if it is improving, so the more chances are in the writing subtest, not others. So that was all about the OET session. Um, we are planning to introduce our course, and you all are requested to share it later on with your friends, and you all can take the demo class later on of our writing and speaking session, and decide on yourself whether it's what you are looking for your OET journey. And we will make it very easy and simple, and yet so definitive that it will make your preparation very well, and you will be able to score the desired band at least in your OET exam. We are working on it, and it will start soon. You should subscribe and follow the Men's Institute's page on Facebook and Instagram, and there you can find all the details. We are working on it, and soon, inshallah, we will introduce the course, and then you can take the demo classes. And if you are satisfied with our course, then you can engage with us. We haven't decided about the fees yet. We will arrange demo classes for the students first, and we will look at the satisfaction rate of the participants, of the candidates, and later on we will decide the fee. So we haven't decided that yet. Satisfaction of the candidate is the most important thing, because everybody here is arranging OET sessions. You can find any subscription you're going to pay them to, but asking for your satisfaction is very rare nowadays. So your satisfaction is the foremost priority through demo classes, and later on, if you are satisfied, the candidates are satisfied, so then we can talk about the other things. So I think that's all about the questions from the OET. I hope I have given you a roadmap of the OET, though it was not a very thorough session because of the short time and just an introductory webinar. We will, inshallah, uh, have another session soon about each of the subtests alone, on which we'll singularly talk about each subtest in more details, and we'll arrange a proper slides. And I hope that will help you guys a lot with your preparation, because OET exam is quite tough nowadays. So, inshallah, we will work together to help you clear your exam in the very first go. So, I think that's all from the question side. Thank you everyone for participating, taking time of your busy schedule, and coming here, listening to me. It means a lot. So, thank you so much for your time.
Thank you, Dr. Hamza, for the wonderful session. Okay, Allah Hafiz.
Allah Hafiz.